Appreciate this. Let the Senate Health and Human Services Committee come to order. Senator Kirkpatrick opened us up in prayer. Appreciate that.
Thank you. Dear Heavenly Father, thank you for this beautiful day in Georgia. Please, as our days get longer and we all get really tired, please give us strength and energy to do the right thing for the people of Georgia. In your holy name, amen.
Thanks, Senator Kirkpatrick. We certainly do need these words of calm and peace as we get through these last few days. Here we are on day 21, and the pace certainly has picked up. So we got two bills today, both Senate bills. Just a heads up, we're going to be doing House bills on Wednesday, which is tomorrow. So let it be known far and wide that the Senate is doing House bills. And I understand this morning the committee I attended did some House bills. So I understand that the House is being very cooperative in doing Senate bills. So we are so happy that we're all working together on this day. 21, February 23rd. Senator Walker, you can sit at your place or you can get to the podium, whichever one you feel comfortable, and you're on mic. You want to go to the podium, which is great. Podium mic is on and the floor is yours.
Thank you, Mr. Chairman and committee members. I bring to you this afternoon Senate Bill 215. I've been working with the Georgia Healthcare Association that represents our nursing homes in Georgia on this bill. As you all are aware, the workforce challenges have been pretty immense for nursing homes during the COVID-19 pandemic, and this bill is a measure to try to help in that area and relieve some of the shortages with our nurses. It also provides a good advancement path or career path for certified nursing assistants. It basically would allow certified nursing assistants to undergo additional training and get a certification to become a certified medication aide. And once they did that and met all the other requirements outlined here in the bill, they would be able to administer medications to nursing home residents only, and they would not be allowed to administer any Schedule II substances, but they would be able, and it lists out on line 27 through 34 some examples of the type of medications they would be able to administer. And then if you look on line 42, the medication would have to be in unit or multi-dose packaging. This CNAs can already become certified medication aides and do this in assisted living facilities. That's already in current law, but they're not allowed to do it in nursing homes. So I think this is a good measure to help allow the nursing homes to better take care of our elderly and frail citizens. Be happy to answer any questions.
We have a question, Senator Kirkpatrick.
Yeah, number 3. Thank you, Senator Walker. You and I have talked about this, and you addressed the concern that I had about controlled substances, and I appreciate that. I guess the only thing that I still have a question about is on line 29 and 30. Obviously, all of this is under physician protocol, which is very important, but I worry a little bit about naming specific drugs, and those are the only drugs that are injectable that are named, because I'm not quite sure where those specific drugs came from, but there might be other injectable drugs that might come into play. And I just wondered if we need to think about making that a little bit broader. More general. Right.
I really don't know the answer to that question.
Did you have any drugs in mind, or we can always circle back if we need to amend this as we go along? I can't think of any drugs off the top of my head in addition to that would be administered.
I just always worry about putting specifics in when things
Yeah.
do change, and there might be a new drug next year. You
Maybe,
know,
but,
let me give you an example. What about subcutaneous heparin, for example?
Yeah, or Lovenox or something like
Lovenox,
that. Yeah,
something like that.
probably, I think what they're saying is that probably the nurse would be doing those. So I think, so if they wouldn't be able to do this, then someone with higher qualification. Yeah, is that right, Senator
That
Walker?
would be my understanding, yes, sir.
I mean, the other way to address it would be change it to insulin, epinephrine, B12, and other.
Yeah, I don't know what I
injectable
want to
drugs
start
or-
adding in. I'll leave it to the author here, but.
I'm just raising the issue because I don't want to box the staff in if there's something else that comes up that.
I appreciate that. We have, we vetted this with the, I think, Medical Association of Georgia and a lot of the nursing associations. I don't have
And
enough.
the pharmacists were involved also.
Yes, sir. I don't have enough expertise really to speak to that. We do have Miss Pam Clayton, I believe, is watching us virtually and is logged in. If you all would like to hear her testimony, she's a nursing home owner and operator, and she can speak to that a lot better than I can. With the
Thank you, Ms.
chairman's.
Clayton. Can you identify yourself? Can you hear us? And can you tell us who you're with? And
Yes, good afternoon. I hope you all can hear me okay. I am Pam Clayton. I am actually with the Georgia Healthcare Association supporting quality advancement and regulatory affairs. I am a registered nurse also. Prior to joining the Georgia Healthcare Association, I was on the provider side for 20 plus years, both in clinical practice and operations. So, and certainly appreciate the issue brought forward and thinking about not constraining or boxing in. I think what we were seeking to do was to be very clear that we weren't looking to open a door too widely so as to cause any concerns relative to what the certified medication aid would be doing versus the licensed nurses there in the skilled nursing facilities, as they will continue to be present around the clock. But to your point, Dr. Kirkpatrick, everything would be done under the physician orders. And so I think, we always have clarity through the physician order process, but we were seeking to be clear that we were wanting to provide greater scope than what anyone would be comfortable with the certified medication aid. And we did feel like B12, the insulin, and epinephrine were appropriate with appropriate training for the certified medication aid.
Thank you so much. We appreciate your thoughts. Well, it looks like we do have a question from Senator Orrock.
Thank you, Mr. Chair. Thanks to the author. On line 17 through 21, the certified medication aid is listed in the medication aid registry. Does that exist already? And what does it take to get on that registry? I'm just cautionary about the care of the patients in a nursing home, because there have been some less than favorable outcomes in nursing home settings. There've been,
If you look at the analysis, you'll see down there in the first paragraph and in A, I think answers your question.
did you say the first?
First paragraph.
Okay, I hadn't seen the analysis yet, yeah.
Okay, that's okay.
Thank you.
You have any other questions? Number 14.
Thank you, Mr. Chairman. Senator Walker, I was just curious, or this may be to the physicians on the committee, but line 14, the certified medication aid, is that a new designation that doesn't exist in code now, but it will after this, or is that just a generic reference to what this type work position will include or involve?
So my understanding is it is relatively new, but it's already a designation that's out there and being used in assisted living facilities.
Okay.
It's just not been allowed in nursing homes and skilled nursing facilities.
Okay. Thank you.
Okay. Do we have any other questions, or Senator Hatchett? Okay. Second. All right. So we have our Senate Bill 215, LC 338675S. This is Senate Bill 215 as a substitute. All those in favor say aye. All those opposed, like sign. Passed unanimously. Thank you, Senator Walker. Appreciate you bringing that. I think that will add to the care in nursing homes and increase quality, increase transparency, and we really appreciate that. Thank you so much. I'm going to need some help here. Senator Burke is not here. He is the vice chair, and I have a bill that I'm presenting. Would that go to the next person?
Secretary.
That goes to the secretary? All right, so who is our secretary? All right, Chairman Dolezal.
He wants to talk about numerators and denominators.
Fractions.
Yeah. Hold on just a second.
Betsy said she's good to go on that.
Okay, sounds good. I'm going to have it up.
I know y'all been waiting a long time for this moment. Chairman Watson, the podium and microphone are yours.
Thanks, Chairman Dolezal. Appreciate that. I picked up the wrong analysis. Give me just a second. Oops. Thank you, committee. Senate Bill 235. Let me just give you a little background. So there was legislation that existed that prevented, and if you'll see there in Senate Research Office Policy Brief, you'll see that it was against the law to wear hoods and masks, and that has to go back to the Ku Klux Klan days, and that actually, there was a suit that went up to the Georgia Supreme Court in 2018. And that was, if you look down there, the next to the last paragraph on the Senate Research Office Policy Brief for the basis of arresting counter-protesters who were protesting at a neo-Nazi rally. So that led to that Supreme Court case, and you'll see it's very well outlined by Senate Research along with the conclusion. So there was anti-mask law, and obviously during a state of an epidemic, pandemic, I should say, with COVID-19, the governor, through emergency orders, made it legal to wear masks in public or on private land. So what happens when that law, the emergency orders end, which we hope that ends sooner rather than later, then it goes back to the previous law. So we certainly want to be able to allow people to wear a mask when it relates to whether it's COVID-19 that still may be in existence and probably will be in existence, or whether it's relating to influenza, which is almost as infectious, or if you're undergoing chemotherapy and you don't want to catch another infectious disease that would allow you to wear a mask. So we have to fit that into the original language of the law. And I had always wondered about that because, practicing medicine, I take care of patients that have undergone chemotherapy. They come in wearing a mask. And, I'll be honest is that, when I see a patient in the office, you know, in the past, they wouldn't necessarily be wearing a mask, and I wouldn't be wearing a mask. Now, they wear a mask, and I wear a mask. But during times of influenza, during wintertime, you know, and a patient comes in sick, you know, should they be wearing a mask, and should I be wearing a mask? Probably so in the future. I mean, I think that's probably what we're heading to from an infectious disease standpoint. There will be changes relating to this, and certainly we'll adapt and adjust as we go along. So, if we do not have this legislation, people wearing masks like that would be illegal. And I do want to, I'm asking for input from the three lawyers on the committee, Senators Kennedy and Calzert and Hatchett, that this did go back to the Supreme Court, and I would like for this piece of legislation not to go back to the Supreme Court. So I would love to have your input and you look at this. I will say if you, so what we're doing, we're adding mask. If you look at in section 1, if you look at being able to wear a mask and hood on his or her face, so hidden his or her identity. And then line 15 is upon any public, private property. Moving over to private property. And then the 19 goes to intent, intends to conceal his or her identity with reasonable foresight. The injury would probably result in these things: threatening, intimidating, provoking violence, reckless disregard of consequences, acts of heedless indifference. So that's relating to what's, that's cleaning up the language from before without limiting the generality of the subsection A. So wearing, there obviously have got to be exceptions, and that was what was allowed to before. Wearing a traditional holiday costume, as in like Halloween, or if you're in lawfully engaging in trade, employment, or in a sporting activity, as you could imagine. And using a mask in a theatrical production, like in Mardi Gras, so forth, masquerade balls. Wearing a gas mask, that's another mask. And then for the last one, you see down there, line 36, wearing a mask for the purpose of complying with the guidance of any health care agency or to prevent the spread of COVID-19 or other coronaviruses. And this is where actually I'm going to ask for an amendment, or influenza or other infectious diseases. And I think if you add in or other infectious diseases, I think that takes care of the person who's gotten chemotherapy, does not want to catch as even a cold from someone else, much less anything more serious than a mild coronavirus, and not the coronavirus that causes COVID-19, right? So with that, I hope I didn't belabor the point too much, but I just wanted to go through the bill. And Mr. Chairman, I'll be happy to answer any questions.
Thank you, Chairman Watson. Senator Kirkpatrick.
Well, first a comment. I had the privilege of going to Japan in fall of 2019, right before the pandemic started. And I noticed that people were wearing masks. Not everybody, but a lot of people. And it's very common in some cultures, just as a courtesy, for people to wear masks if they're concerned that they have a cold or whatever. And it seemed odd to me at the time because we're not used to seeing that in the United States. And now it's become part of our culture to wear a mask. So I support what you're trying to do here. Were you going to try to amend this to cover other infectious diseases?
Yes, and I, if the chairman would allow this amendment, so on line 37, it would say, or other coronaviruses. That's be a Scribner's error, or influenza, or other infectious diseases.
Senator Calzert, you're number 15.
Yes. Chairman, is cancer an infectious disease?
No, but so a person with cancer and is undergoing chemotherapy, their immune system is suppressed, so they don't want to catch a cold, so they will wear a mask in public.
It said this would be worn to prevent the spread of COVID or other infectious. Are you just saying if somebody's had immunotherapy or
Yes.
cancer treatment, they could wear that?
So that You know, it may be that, let's see, it may need to go before, after the word agency then. Would that be better? I'm going to ask for your help on that. Wearing a mask for the purpose of complying with the guidance of any healthcare agency or prevention of infectious disease or to prevent the spread of COVID-19, other coronaviruses, or influenza.
Chairman Watson, you have the lawyers all worked up here. I'm going to recognize
I think
Counselor
that-
Hatch.
All right, well, I will certainly ask for help.
Yeah, Mr. Chairman, I think the spread of coronavirus could apply to the cancer patient because it would be spreading the disease to him or her.
Yeah.
So I think it's okay, but I would, if the author would entertain this, I would include healthcare agency or healthcare provider, because in a time when there's not a pandemic, if a healthcare provider tells a cancer patient not to wear a mask out in public, I would like for that protection to expand to them as well.
Do you want to draft that in the form of a motion? Or-
Yes,
And we'll come back to you.
if the author, yes.
Yeah.
Any other questions? Senator Halpern, number 5.
Just a question, because this is moving this into a different direction, but there's no definition, as this is written, on what actually conceals your identity, right? So like masks, obviously, we can all see each other's eyes. I presume, right, that is not concealing one's identity. And so, right, so that's the thing. I feel like there's some wiggle room in here, and frankly, like, I'm thinking about, like, my sons who wear hoodies with hats. Their whole faces obviously aren't hidden. You can see you're able to see some of their face or all of their face, and I'm just wondering, in a context like that, where there isn't the definition of like what actually are we saying when we say conceal your identity? Do your eyes have to be showing? What has to be showing?
And I'll defer to the lawyers to maybe help me out, but I think it goes to intent. If you look at the first part, I think that was the original aspect relating to the bill and the Ku Klux Klan relating to that.
Right.
So I think it goes to line 19, intends to conceal his or her identity. Number 20, with reasonable foresight, and it says and, intends to conceal his or her identity, and with reasonable foresight, the injury would probably result, intends to threaten, intimidate, provoke the apprehension of violence, and it goes so forth.
Okay. Thank you.
Senator Hatchett, did you still have another question? Great. Chairman Watson, I have a question. This will be relevant to some of the activity we saw last summer, where we saw rioters in the streets with their concealed faces, obviously inflicting harm on property and, in some cases, people. And so would this trigger there'd be an unlawful act then, should you attend one of these gatherings, I guess, with the intent to do harm and you were wearing a mask? Is that correct?
Right. That's not the intent of this bill. This intent of the bill is for infectious disease aspect
Sure.
relating to that. But, I'd have to defer to the lawyers in the room, or maybe the public safety folks relating to that. There was an emergency order during that time, so I presume that those laws were suspended. So I presume that's why there wasn't any action on that. So going into the future, if it applies, I would presume that would be the case.
I think the helpful part of your bill is that it does specifically add the intent versus just the act of wearing a face covering. Any other questions from the committee? Senator Hatcher, are you prepared to make a motion for an amendment?
Yes, I move that we amend the bill to add on line 37, healthcare provider after the word or.
After the first or?
After the first or.
So could you read the whole line 36 and 37 so I'm clear?
So it would say wearing a mask starting on line 36, my amendment would say, wearing a mask for the purpose of complying with the guidance of any healthcare agency or healthcare provider to prevent the spread of COVID-19 or other coronavirus or influenza or other infectious disease.
So that makes sense, because what you're saying is that the healthcare provider is guidance of the healthcare provider guiding that chemotherapy patient to wear a mask. I got you. Okay, that makes sense to me. I'm good with that. Does that make sense to everybody? Getting a nod over here from.
We have a motion. Do we have a second? Second by Senator Kirkpatrick. We have a motion and a second for the amendment. All those in favor, please signify by saying aye. All those opposed, like sign. The amendment passes unanimously. We are now back to the main bill. Do we have a motion? Senator Walker?
So I move we do pass Senate Bill 235 by committee substitute.
As amended? No. Got it. Thank you. You're correct, Mr. Chairman. Thank you. We have a motion. Do we have a second? Second by Senator Orrock. We have a motion and a second. All those in favor, please signify by saying aye. Aye. All those opposed, like sign. Motion passes unanimously. And Chairman Watson, you can have your throne back over here.
Yeah, thank you. And I really don't have any further business. We're going to have two bills, again, House bills, tomorrow. And unless there's any further business, I want to thank Senator Hatchett for that amendment, and meeting adjourned.